Hello and welcome. Now, today we are going to see the introduction of antimicrobial drugs, mainly on the objective of mode of antimicrobial actions. Don't forget to like and subscribe to this video. As introduction, it is better to differentiate broad versus narrow spectrums, bacteriostatics versus bactericidal antibiotics, and mode of antimicrobial actions on the agent. And it is better to know about the antimicrobial resistance and how it occurs, and finally the clinical use of antibiotics. So antibiotics that are limited to treat specific infection are known as narrow spectrums, while those that can treat wide range of infection are called broad spectrums. So narrow spectrum drugs are sometimes preferred because they target on the specific pathogens without disturbing the normal flora of the gut. Broad spectrum drugs are sometimes preferred for the essential treatment of infections when the causative pathogen is not identified. These pictures shows the difference between broad spectrum and narrow spectrum antibiotics. So when you see streptomycins, these drugs act on the mycobacteria or gram-negative bacteria, whereas penicillins act on the gram-positive bacteria. So this penicillin and streptomycins in narrow spectrum antibiotic, while tetracycline is a broad-spectrum antibiotic which acts on gram-negatives and gram-positive bacteria, in addition to the chlamydia and rickettsia. When you see the difference between bacteriostatic versus bactericidal drugs, so bacteriostatic agents such as tetracycline inhibits the growth and the multiplication of bacteria. However, if the agent is removed, the cells once again multiply. Bactericidal agents such as fluoroquinolones not only inhibit the growth of cells but also trigger the pathways when the cells that leads to cell death. So the action of the bactericidal drugs is irreversible. These pictures is very explanatory about the mechanism of action of chemotherapy. So some drugs may interfere with the cell wall, and the others may interfere on the plasma membrane or cell membranes. Some may interfere on the process synthesis, and the others may interfere on the metabolic pathways. And finally, the others may interfere on the nucleic acid synthesis. Generally, beta-lactam drugs like penicillins, cephalosporins, and monobactams and carbapenems act on the cell wall of the bacteria, whereas the polymyxin drugs may interfere on the plasma membrane or the cell membrane of the bacteria and may result death of the cells. When you see the aminoglycoside and tetracyclines acts on the 30S subunit of the ribosome of the bacteria, and macrolides, lincosamide, chloramphenicol, oxalidones may act on the 50S subunit of the ribosomes and may result protein synthesis inhibitions. So here, most drugs that act on the photosynthesis may result as just interference of photosynthesis are bacteriostatic agents, whereas the aminoglycoside is just it acts on the photosynthesis, but it may result as the bactericidal actions. Sulfonamides and trimethoprimes may interfere on the folic acid synthesis, and finally may result as the inhibition of the metabolic pathways. And some drugs like fluoroquinolones and rifampicins may interfere on the nucleic acid synthesis. So this picture is another illustrative or explanatory picture for the mechanism of action of the antimicrobial drugs. When we see the trimethoprams and sulfonamides may compete. When you see the sulfonamide, it competes to PABA for the DHF dihydrofolates, whereas the trimethoprams may interfere with the or compete with PABA for the THF. So this picture is also illustrative of the mode of antibiotic action of the bacteria. As a summary, now today we have seen about the mode of antimicrobial actions and the difference between bactericidals and bacteriostatic agents. And in addition to this, we have seen also the difference between the broad spectrum antibiotics and narrow spectrum antibiotics. In the next video, we will see the mechanism of antimicrobial resistance. And until that, see you again.